Chemotherapy is debilitating on its own, but a major concern for many women undergoing the treatment is hair loss. Perhaps until now, a new technique seems to help reduce the risk and severity. They're called cold caps, a frozen cap worn tightly on the head before, during, and sometime after a chemotherapy session. Sure, the method can be consuming and uncomfortable, but the results are clear. The devices are not yet FDA approved, but researchers on current studies hope they will lead to FDA approval and insurance coverage. Eating peanuts is associated with a lower risk for cardiovascular disease and death. That's according to a new large study published in JAMA. The findings aren't anything new, as previous studies have linked high intake of nuts to reduced risk of mortality. Researchers in this study looked at more than 70,000 Americans and more than 134,000 Chinese individuals. The nut intake was self-reported, though it showed cardiovascular benefits by as much as 21% mortality risk reduction. Finally, should women use hormone replacement therapy for menopausal symptoms? Some studies suggest no. Recent studies have shown an increased risk of cancer mortality with using hormone replacement therapy. The treatment is often prescribed, though, for women undergoing the negative effects of menopause, like hot flashes and poor sleep. But now, over 50 studies have found a slightly increased risk of ovarian cancer with use of HRT. The risk was increased by between 37 and 43%, depending on the length of use. The findings are worrisome, but not conclusive. More research is needed. You can read this story and the others on our website at aksha.org, and don't forget while you're there to also sign up for your daily dose of news, delivered straight to your inbox.